positive behaviour support can be perceived as something that's useful for people with intellectual disabilities, autistic individuals. And is there anyone else? Would it benefit anyone else? The reality is it benefits everyone, okay? Because what are we saying? At a very simple level, find out what upsets people. Try not to let that happen so much. Find out what makes people happy. Try to make that happen more, okay? That is a very, very simple conceptualization of what we're trying to achieve. So at home in Ireland, I provide positive behaviour support in older person services, nursing homes, for people with dementia, for people with Alzheimer's. For my oldest person who I have worked with at this point in my career is a 98-year-old woman who was in a nursing home who, when staff would provide her with personal care and intimate care and help her with those aspects of her needs, she would grab them and she would scratch them, and the poor woman ultimately was frightened. She's visually impaired. She doesn't know what's happening. People are providing care to her, but they're not letting her be a partner in the care. They're not letting her be. They're not asking her for agreement in the provision of the care. So positive behaviour support quite simply says, look, when you're going to support that woman with her intimate care, let her help you with it. Let her be a partner. Make sure that she knows what's happening. Make sure she understands what you're about to try and achieve with her. And she will not be frightened, and then she won't have to be grabbing you, because the reason she's grabbing you is because she's frightened, because she's visually impaired. So 98 years of age. I have worked with children without intellectual disabilities or autism who are in maybe the childcare system or the foster care system in Ireland, who maybe are having their behavioural difficulties as a result of very traumatic experiences or early difficult traumatic experiences in their childhood or adverse childhood experiences, who are having maybe more of a trauma response, and their behaviour is being perceived as the child being difficult, but it's more so that the child is traumatised by its early childhood experiences. I have done some work in mainstream secondary schools in Ireland with pupils and students there, usually kind of trying to I suppose, get the classroom system or the teaching system to kind of understand that in a room full of 30 people, you're going to have 30 individuals, and not everybody is able to just conform the way the school would like them to. And in Ireland, we're working quite a bit now in the mental health services and the psychiatric services, where they're starting to see great value in positive behaviour support for people with mental health difficulties. And really what we're trying to work on there is trying to differentiate, when is the person having a crisis because it's a mental health crisis, or when is the person having a crisis because it's a behavioural crisis.